Your ophthalmologist has diagnosed a detached retina. This condition occurs when the tissue lining the back of your eye is lifted or pulled away. A detached retina is a very serious condition that almost always causes blindness if not treated. To repair your retina, your eye surgeon recommends a procedure called vitrectomy. This surgery can help to prevent further retinal damage and may save your remaining sight. To understand how a detached retina affects your vision, let's take a look at how the eye works. Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, the light-sensitive tissue lining the back of the eye. The retina has two areas, the peripheral retina, which gives us our side or wide-angle vision, and the macula, the small area in the center of the retina. The macula gives us our pinpoint vision, allowing us to see detail clearly. The inner eye is filled with a clear, jelly-like substance called vitreous. As we age, the vitreous becomes less like jelly and more like liquid. Usually the vitreous is only loosely attached to the retina, so as the eye moves, the vitreous moves away from the retina without causing problems. Sometimes, though, the vitreous pulls hard enough to tear the retina. Fluid passes through the tear and lifts the retina off the back of the eye. This is called a retinal detachment. The retina doesn't work when it is detached, and vision becomes blurred. A retinal detachment is a very serious problem that almost always causes blindness unless it is treated. Your ophthalmologist will repair your retina with a procedure called vitrectomy. The vitreous gel that is pulling on the retina will be removed from your eye and usually replaced with a gas or oil bubble to keep your retina in place to heal. This procedure is usually done in the operating room, and your eye surgeon will use either a local or general anesthesia. During a vitrectomy, your ophthalmologist makes a tiny incision in the sclera, or the white of the eye. A small instrument is placed into the eye to remove the vitreous gel. Once the vitreous is removed, your surgeon will inject a gas or silicone oil bubble in the eye to push the retina back against the wall of the eye. The tears and weak areas of the retina are then sealed with either a freezing probe or a laser treatment. After surgery, your ophthalmologist may recommend that you keep your head in a special position for a certain period of time to keep the bubble in place. As you recover, your eye naturally makes fluid that gradually fills the eye, replacing the gas bubble. An oil bubble will need to be removed from the eye at a later date with another surgical procedure. Avoid air travel with a gas bubble in your eye. Also, if you're going to have any other surgery, be sure to let your anesthesiologist know before surgery that you have a gas bubble in your eye. It's important to remember that retinal detachment is a very serious eye condition. The eye may take several months to fully heal, and your vision may be permanently changed even after healing is complete. The retina is very sensitive tissue, and the damage caused by retinal detachment could result in loss of vision in the eye, even with successful surgery. As with any procedure, there are risks of side effects and complications with vitrectomy surgery. These may include bleeding, eye infection, another retinal detachment, new or recurring scar tissue inside the eye, clouding or scarring of the cornea, clouding of the lens of the eye or cataract, a droopy eyelid, increased pressure in the eye called glaucoma, vision loss, and the possible need for additional treatment, including medication and surgery. Also, your eye problem could remain or get worse. Call your ophthalmologist right away if you notice any of the following problems after surgery: a decrease in your vision, increasing pain in your eye, increasing redness of your eye, swelling around the eye, any discharge from the eye, any new floaters, flashes of light, or other changes in your field of vision. Other treatment options may be available for your retinal detachment. Depending on your condition, these options could include a scleral buckle. This is a flexible band placed around the eye to counteract the force that's pulling the retina out of place. Another option is pneumatic retinopexy. an in-office procedure where a gas bubble is used to hold the retina in place. Your ophthalmologist can explain why he or she chose vitrectomy for your particular course of treatment. You don't have to be treated for retinal detachment. However, without treatment, it is very likely you will lose vision in that eye. The main goal of treatment is to preserve your vision. Be sure to keep all appointments with your ophthalmologist after treatments. Also, if you have any changes in your vision, you should call your ophthalmologist right away. Monitoring your vision is a vital step toward the goal of preserving your sight.